We are the Association of Nigerian Private Medical Practitioners, ANPMP.
My name is Ambassador Dr. Ike Odo, National President of the Association of Nigerian Private Medical Practitioners, ANPMP. This is a recorded version of the appeal that the ANPMP is making to the National Electricity Regulatory Commission, NEC, through our hired consultant, who is already engaging them with facts and figures on the suffocating and stifling, demoralizing, overbearing cost of power on private hospitals and clinics and healthcare professionals across the country. Please listen.
Yes, the overheads of running hospital is enormous, especially in Nigeria, and it's obvious from all available records that cost of power after salary is the highest on the list. And it surprises us that as doctors, social welfare workers, we pay the same tariff on power as banks, hotels, oil companies, and other commercial ventures. There is nowhere in the world this happens. From India to Dubai to UAE to Europe to America. In healthcare financing, there are so many things that account for healthcare financing. Whatever brings down the cost of providing medical service is considered a healthcare finance instrument. Reduced subsidized cost of power is helping to fund healthcare. It helps bring the cost of a service down and therefore brings down the cost of the bill available to the patient. If the hospital is giving concessional banking interest rate, it's healthcare financing. If hospitals are giving import duty waivers for their drugs, consumables, and equipment, it is healthcare financing because it's helping to reduce cost of production or cost of service. If we pay less for power, we are supporting to promote affordable and accessible and quality healthcare. It's healthcare financing. Now, people may want to wonder, why are Nigerians, Nigerian doctors, Nigerian nurses, radiologists, radiographers, they're all leaving the country in droves. And very soon, it will be very difficult to run our healthcare institution because there will be no professionals at home. Why are they leaving? Many are leaving because their salaries can't take them anywhere, both in public and private. Insecurity is there to contend with. Very poor working environment is there to contend with. There are doctors who ordinarily will wish to open these facilities, hospitals, and run. But how can they run it when they don't have the capital, when they cannot afford the issue of power? Today, for example, for you to own a hospital or clinic and have it accredited by the State Ministry of Health and other accrediting agencies, including the Federal Ministry and the agencies of government, companies, health maintenance organizations, even corporate organizations when it comes to retainerships, like Shell, Ajib, Chevron, and other IOCs. You must show evidence of having the direct supply from the national grid, 1. 2, you must show evidence of at least 2 generators. 2, not 1, as backup. How many Nigerians can afford it in these difficult times? So when you see that as a startup, you can't go to the bank, you can't pay their interest, you cannot afford power to 24 hours a day, because 1, the cost of the tariff you can't bear. Generator you cannot buy. You run out of the country. Those of us who have made up our mind to stay back, sometimes we are posting losses at the end of the month because of power. And so that's why the appeal is being made. It's a national assignment, a national burden, a national responsibility, a national task that we think we should all respond to. It calls for understanding, and it calls for the long vision of the overall impact on the Nigerian system, the healthcare system, the economy. Because if we had power alone will encourage more hospitals to spring up. More than half of Nigerians living the country will stay back. People will now be happy to go to the villages and open up facilities. Nigerians will stop dying the way they are dying. It's a shame that the life expectancy of the average Nigerian is 53 years. Everything we do to support our industry, to support our healthcare system, is contributing to revamping the industry, to rejuvenating the industry, to transforming the industry, to increasing value and utility, restoring dignity, value into the system. Right now, as we speak, statistics are clear that Nigeria as a country spends over 600 billion naira every year in paying for overseas treatment in the name of medical tourism out of Nigeria. And yet, if we take measures to address our own challenges, our difficulties, our peculiar terrain, and the ecosystem of marrying in synergy the health system, the economy, banking, power, utilities, and all that, and they are attractive, we will achieve what India has achieved and surpass it. Now the question is, what is the secret of India? Before the 80s and early 90s, India was worse than Nigeria in their economy, in their institutions, professional groups, including medical. And they were all over Nigeria begging for jobs. And they took salaries below those of Nigerians. And they were happy. Today, I have an Indian doctor, and all over the country, Indians proudly tell you they are expatriates. And you pay them accordingly. What happened? The Indian government, early in the 90s, took referendum, sent ambassadors, emissaries across the world, from Europe to Canada, to Australia, to UAE, to sensitize Indians, to mobilize them, to say we need to build our own health system. Come, let us reason together. And the Indian government interfaced with the health system, and they agreed on points of development. What must we do to support you to develop a robust, qualitative, and competitive healthcare system and become relevant in that regard? And the doctors gave them all that was necessary, including financing where interest rates are just one single digit. To the extent that as I speak to you, I had an interface 3 months ago with the team from Narayana Healthcare City in India, where they see over 10,000 patients in a day. It's a massive expanse of a community of hospitals. Groups of hospitals agreed to buy an entire layout. You are cardiology, you establish cardiology. I am nephrology, I establish nephrology. They're into estates, plots. I am gynecology, I establish gynecology. pediatric. So once you drive into that ecosystem, whatever industry, surgery is there, neuro is there, pediatrics is there, anesthesia is there, everything medical. Guess what? I told my guests about my hospital. They're trying to showcase my pedigree, the journey I have traveled, the pains, the burden I had gone through, for example. So I told them how much I bought the land on which I built. And they said to me, "You bought the land?" I said, "Yes." He said, "Why?" I said, "No, I don't come from River State. I am an indigene of Enugu State, but I live and work here. So I had to buy. The land on which Narayana Healthcare City was standing, nothing was paid. As part of government support, that land was given free. Things don't work that way here. The money they use to develop the facilities, single-digit loan, 6 to 7 years moratorium, 25 years tenure or more. It encouraged Indians to start trooping back to the country. To the point now, as we speak, they have so developed their healthcare industry that Americans, Canadians, Australians are going to India. Yes. India will give you the same quality at less than half the price in America. So these are the things to encourage them as social workers. This is the case we want to make to our country. We have a large population of doctors rendering, supporting this country. Without us, Nigerians will be dying more than they are doing today. Now it's on strike. Who is doing the job? Private doctors. What is government doing for us? Bank rates, they're not addressing. Import duties, they're not addressing. Security, they're not addressing. Power, they're not addressing. We are being submerged.
My name is Ambassador Dr. Ike Odo, National President of the Association of Nigerian Private Medical Practitioners, ANPMP.
We are the Association of Nigerian Private Medical Practitioners, ANPMP forever. ANPMP,
we are greater together.